So with that said, we developed the speaker series. We were at the June speaker, Benjamin Bellet from Harvard University. And then we also have our final speaker July 7th at 1 o'clock. Okay, with that said, I will stop sharing my screen and I will turn it over to Ben.
All right, hello everyone. Speaking of triggering, this is my first time doing a webinar, so I have no idea who's looking at me or what's being said in the various rooms from which people are watching. I'm joining y'all from Harvard University up on the 12th floor of William James Hall. It's a pretty dreary day out. I hope the weather is better up in Canada. And I wanted to first thank Rob for inviting me to speak here. And Fox News, incidentally, will make an appearance in this presentation, so I'm glad it was mentioned. So I'm gonna just get these slides shared on my screen here. Okay. And if I could get a thumbs up from somebody in the chat on whether or not y'all can see the slides, that'd be wonderful.
Yeah, they're coming through fine.
Thanks very much. Okay, so the title of this talk is Trigger Warnings, Controversies, and Conclusions. I'm going to go over the empirical data on trigger warnings, both work that myself and my lab have done, as well as some other research that's followed on the heels of the initial studies that we did on trigger warnings. Initially, when Rob invited me to give this talk, I thought I was just going to be giving sort of an overview of the very mixed findings on trigger warnings. One of the reasons I think there continues to be a lot of controversy around trigger warnings is not just because it's sort of a morally contentious topic, but because the findings have been very mixed. Serendipitously, though, my colleagues and I, actually we have a collaborator over in Australia who's working with us on this. We've done a meta-analysis on all these various studies, and so those results came in at just the right time. So y'all are going to get actually the results of the meta-analysis hot off the presses. So we'll just jump right into it. Yeah, and I'm Ben. I'm a PhD candidate in clinical psychology at the Harvard University Department of Psychology. Okay, so let's jump right in. If I can get the slide to advance. There we go. Okay, so first off, I think particularly when we're looking at cultural phenomena that tend to be very emotionally charged, it's good to rigorously define our terms. And I do think that the preemptive statement that Rob gave does qualify as a trigger warning. So what is a trigger warning? Okay, well, let's say you're teaching a class on Russian literature to some undergraduate students, some college freshmen, and you're going to teach about Fyodor Dostoevsky's famous book, Crime and Punishment. And in Crime and Punishment, as many people here probably know, there's this famous murder scene where Raskolnikov, the protagonist, murders this pawnbroker. It's a very graphic scene. It's tough for me to read even now. I've read it several times. And you may be worried that perhaps some of the students in your class have experienced physical violence in their past. And so you might offer something like the following. Trigger warning: the content you're about to read contains graphic violence and may trigger an anxiety response, especially in trauma survivors. So what we're talking about with a trigger warning here, as opposed to like a content note or a course syllabus that just contains an objective statement about what's being presented, right? That this would be something like a content note. Objectively speaking, the content you're about to read contains graphic violence. What we're talking about with trigger warnings is something that goes a little further and makes some sort of an insinuation about a potential emotional or psychological response you might have. And then added to that, often with trigger warnings, there's other directions these things can go. So often trigger warnings will include which particular subpopulation of student or consumer of information might be disproportionately affected. So it could be a trauma survivor or someone whose family has historically been the victim of colonial oppression. Trigger warnings can also contain advisories for what to do if you're feeling distressed, right? You might want to avail yourself of campus counseling resources or something like that. Okay, so where did trigger warnings start out? So as far as we can tell, trigger warnings originated in online blogs that were designed to allow survivors of sexual assault to discuss their experiences. So often when discussing experiences of sexual assault, personal narratives emerge, right? People want to share their story of what happened to them. And so the idea was you'd affix a trigger warning to an account that might trigger re-experiencing symptoms or flashbacks of post-traumatic stress disorder in those who had also experienced sexual assault. And the notion that those with PTSD are disproportionately affected by reminders of traumatic events is based on good science, right? So in the DSM-5, actually, I think we're at DSM-5 TR now, which recently came out. But regardless of the addition, pronounced physiological and emotional reactivity to reminders is one of the diagnostic criteria for post-traumatic stress disorder. And we believe this arises because of something called a fear structure. So at the time of a traumatic event, physical symptoms like elevated heart rate, emotional responses like fear, contextual details like the smell of alcohol on someone's breath, thoughts like I'm going to die, and behavioral responses like cowering all become very tightly linked in this fear structure. And so months or even years later, if you're exposed to a reminder of that traumatic event, like maybe you're in a bar and you smell alcohol on someone's breath, that can trigger this entire network of behavioral and emotional responses, resulting in this sense that you're actively re-experiencing the traumatic event. Okay, so however, what happened with trigger warnings is that they expanded. And they expanded in two ways. One is they obviously they continue online, but they expanded into the classroom. And I think that's where a lot of the controversy started to arise. The second respect in which trigger warnings expanded is in these online blogs, right? They were being used for cues or stories that might specifically trigger trauma survivors. So this other way in which trigger warnings have expanded is they've moved past things that could potentially be trauma-related cues to content that could be distressing to students for a large variety of reasons. So an example would be, okay, we're about to read an account of colonial domination in the Americas. If you are from a racial minority that has been involved in such racial oppression, you may be disproportionately triggered by this course material. So they've expanded past the classical traumatogenic narrative. Okay, so this resulted in a lot of controversy. Probably one of the big flagship articles of this was The Coddling of the American Mind, written by Jonathan Haidt and Greg Lukianov. But there were a lot of things going pro and con. So in the Wall Street Journal, the New York Times, The Hill, a lot of stuff. Trigger warnings are absolutely necessary, or trigger warnings are a terrible idea and fragilizing our students. So there's been a lot of sort of moral ethical debate. And the way that we might sum this up is as follows. So on the left side of the slide, and perhaps on the left side of the political spectrum, there's been this notion that, look, trigger warnings are a necessary form of disability accommodation for students who might have trouble with course content. So this notion that in a given class, some students from certain backgrounds are going to have a more outsized emotional reaction to certain content. So trigger warnings are a way of leveling the playing field and allowing those students to bring their coping resources online, or giving them informed consent about what content they want to engage with. On the other hand, you have this academic freedom and fragilization concern on the right side of the slide, and also sort of on the right side of the political spectrum for that matter, but not always. The notion here is, with respect to academic freedom, if you're putting a trigger warning in front of a piece of literature or art, that perhaps if you're compelling professors to do that, that's going to compel the way they teach. And so they're not able to teach in as direct and unstructured a manner as they might like to. The other notion that was highlighted by Lukianov and Haidt in The Coddling of the American Mind is that perhaps we're sort of counterintuitively degrading students' psychological resilience by fragilizing them. So the notion here is that if students become accustomed to being warned every time there's going to be something potentially distressing, is that really setting them up for success in the quote unquote real world outside the campus gates? So amidst all this sort of moral ethical controversy on either side, myself and my lab were actually interested in a bit of a different question, which was, but do trigger warnings work in the first place, regardless of the moral ethical concerns? And another way to frame this empirical question is, on balance, are trigger warnings helpful? Are they helping students to maintain emotional equanimity in the classroom? Or are they harmful? Are they in fact fragilizing students or making them more anxious? And the nice thing about asking questions this way is this is an empirically tractable question. And so I'll just give you an example of how we were thinking about this in our first experiment. This is back in 2018. Okay, so looking at anxiety response to the content that trigger warnings accompany. So we can look at that in the lab. One hypothesis might be that trigger warnings are making distressing content more predictable. Now, we know from other lab research that when stressors are perceived as more predictable and controllable, they tend to evoke less of a distress response, right? People have the sense they can control what's coming up. Now, on the other hand, trigger warnings may paradoxically make people more anxious. It could be sort of a self-fulfilling anxiety prophecy, or in other words, a nocebo effect. So a placebo effect, right? The well-known placebo effect in psychological research is you give someone a sugar pill, you tell them, okay, this is going to help you to lift heavier weights, and lo and behold, they can lift heavier weights. A nocebo effect is the same thing, but in the negative direction. So for instance, if you give someone a trigger warning and you say, well, you might be really anxious when you encounter this material, and then perhaps lo and behold, the person's more anxious when they encounter that material. So we wanted to test this very simple question. We had some other questions we wanted to test, but this was sort of the centerpiece of this experiment. So here's how this study went. It's really quite simple. We recruited a total of 270 online participants on Amazon Mechanical Turk, and the goal for all of these participants was to read a series of passages from literature. So we had neutral passages. So an example would be a character description from Charles Dickens' Great Expectations. And then we had potentially triggering passages, which would be, for instance, that passage from Dostoevsky's Crime and Punishment that I previously described. And so they read 5 neutral and 5 potentially distressing passages in random order. And these 270 online participants were randomly assigned to one of 2 conditions. Oh, and I forgot to mention, after reading each passage, they rated their anxiety response. So on a scale of 0 to 100, how anxious do you feel right now? So in the trigger warning condition, each participant got a trigger warning prior to reading the distressing passage. And then in the control condition that some folks were randomized to, there was no trigger warning. There was just a screen that said, you're about to move on to the next passage, click the forward button whenever you're ready. Okay, so I'll jump right into the results. There are other hypotheses that we tested, but for anxiety response, here's what it looked like. So this is a density plot here. Basically, the wider that this little fiddle shape gets, the more responses there were from participants in that condition at that value of anxiety response. And as you can see here, it's kind of ho-hum. There's not any difference between the trigger warning condition and the control condition. Trigger warnings really aren't doing anything. They're not working as intended. They're not making people less anxious, but they're also not making people markedly more anxious. So we published this first study on trigger warnings in a clinical psychology journal, and what immediately came out of that was a good deal of I would say misinterpretation of the results. So we see a whole bunch of different headlines that came out around this, including Fox News, which Fox seemed to be of the opinion that we had discovered evidence that trigger warnings are definitively harmful to students, which was not the case. These weren't college students in our experiment. And really, if anything, they just weren't really working. They were essentially inert. So we decided to replicate this experiment in a college student sample next, because college students are definitely a subpopulation of interest, and there are all these claims being made about college students. So we wanted to see how they work in that particular population. So for this one, we did this study at 2 different sites. One was here at Harvard, which is a very specific sample at a small liberal arts university in the Northeast, and also from Coastal Carolina University, which is a much larger public university in the southern United States. Recruited a total of 462 college students, ran the exact same experiment, and we'll just get to the bottom line here. What we found in this experiment is that overall, a very trivial effect, but trigger warnings were making students more anxious in response to the content that they accompanied. So the mixed results started pretty early. So following those experiments, there were some more expansions on this work. Sanson et al. Used an online crowdsourced sample, similar to our first experiment. They ran a whole bunch of different sub-studies within their study. They used both passages and film clips. And what they found is that trigger warnings, those who received trigger warnings did have slightly less negative emotions. They didn't just measure anxiety, they looked at negative emotion writ large. And there was a trivial decrease in negative emotions in response to trigger warnings. Another study that actually our lab ran, this is my collaborator, Peyton Jones. We looked specifically at trauma survivors. And in trauma survivors, they read the same passages as in our first 2 experiments with the college students and the crowdsourced sample. And what we found is that even for trauma survivors, there was no effect of trigger warnings on anxiety response to these distressing passages. Boyson et al. In a recent experiment, they used online crowdsourced adult samples and some college student samples. The task here was viewing videos, and they measured negative emotion writ large. They saw no effect. Okay, so there's been a lot of mixed effects so far as anxiety response goes. So this leads into why do we run this meta-analysis? Well, number one, as we can see, there's mixed results across studies. Some are saying, oh, trigger warnings are making people a little more anxious, a little less, no effect at all. And I'm sure that no one in the audience here is guilty of this, but often when there's mixed results like this, people tend to cherry pick specific studies with specific effects that favor their ideological position. So we wanted to run a meta-analysis to essentially get some sort of empirical consensus on across studies. When we aggregate across studies, what do we find the effect size likely is? Now, before we go into the meta-analysis, I also want to talk to some other facets of trigger warnings that are of interest that we also included in this meta-analysis and give you some of the back and forth on what's been found there. Some other studies have looked at anticipatory emotions. And what I mean by this is not emotional response to the content that a trigger warning accompanies, but the content or the emotional response to the trigger warning itself. So this question of, are trigger warnings themselves triggering or not? And so one way we might look at this is that trigger warnings are sort of a cold cognitive device, right? They're informational. They're helping students to make an informed choice about whether or not to engage with content and or bring coping resources online for when they view the content. On the other hand, trigger warnings themselves may engender an emotional response. And so that's a question that's been asked by some researchers. And when we look at the literature on this, again, mixed results. Bruce et al. In 2021, they used a student sample. And in this experiment, they told participants, you're going to be watching a film clip. And then they either gave students a trigger warning or didn't give them a trigger warning prior to viewing the film clip. And what they saw is that trigger warnings reliably caused large increases in physiological indicators of anxiety, such as heart rate and skin conductance. On the other hand, you have Boyson et al. In 2021, and in their case, they used just self-reported, how anxious do you feel right now, as opposed to physiological indicators, and they saw no effect with the self-report measures. So we've had mixed effects or mixed results in this area as well. Another important question about trigger warnings is how they shape approach or avoidance behaviors. So and this is actually, when you look at the literature or the rationale for trigger warnings early on, this was really what the point was in the beginning. So the idea is people are going to use trigger warnings as a detour sign. They're going to use them to help steer clear of potentially triggering content. Now, with that said, from everything we know about the treatment of anxiety disorders and post-traumatic stress disorder in clinical psychology, counseling avoidance as a habit is generally not a good idea, right? And indeed, most evidence-based practices for treating post-traumatic stress disorder, for instance, the counsel there is to counter gradually in a supportive therapeutic environment to counter avoidance behaviors and help people to habituate to trauma-related cues. But in any case, there's this question of, do people in fact avoid when they see a trigger warning? The counter to this argument is the well-documented phenomenon of morbid curiosity among humans. This possibility that, well, perhaps in aggregate, trigger warnings make people more likely to view content that's sitting behind them. And so there have been a few studies on avoidance behavior as well. So Bridgeland and Takarangi in 2021, with a large online crowdsourced sample, what they did was they had an image covering or uncovering task. And they would, for some participants, they put a trigger warning in front of or before a picture, and they said, look, this picture may be triggering for you. And participants had the option to cover or leave uncovered the image that followed. And what they found was that trigger warnings really didn't have any effect on covering behavior. Bruce and Roberts in 2020 ran an experiment with undergraduate students. And in this case, they operationalized avoidance a little bit differently. So they gave students 2 articles with a trigger warning and 2 articles without a trigger warning, all of which had potentially distressing titles. And the way it worked here was, do students more often tend to read the articles with the trigger warning or without the trigger warning? And what they actually found was that trigger warnings were conducive to a small increase in avoidance. That is to say, students were a little more likely to approach the articles that had a trigger warning affixed to them. So again, some mixed results with avoidance. It's being operationalized in a lot of different ways. Another question, particularly for the classroom, but also potentially in the therapy room or in group therapy, is how might trigger warnings affect comprehension or retention of concepts that you're trying to teach? So as previously discussed, trigger warnings may help people to bring coping strategies online up front, so they can sort of emotionally brace themselves. And then when they see this distressing content, it doesn't come as a surprise. They retain information more effectively, et cetera, et cetera. On the other hand, trigger warnings may decrement comprehension. So the idea here with cognitive load, right? If you tell somebody that they're about to see something distressing, perhaps they're already worried about seeing something distressing, and the content that they then consume afterwards, which perhaps they may or may not have been particularly distressed by in the first place, well, now they're distracted by scanning for threat. They're deploying selective attention, and they're not getting they're not retaining all the information that's presented because half of their attention is deployed elsewhere. So there's been a few studies that have looked at comprehension as well. Gavick, in a dissertation actually on trigger warnings, looked at college students viewing videos, and they found that there was no net effect on how well students retained details from those videos when trigger warnings were affixed to them versus when they weren't. With Sanson et al. In 2020, again, this large study they did, they saw that trigger warnings were associated, again, with this small, trivial, but an increase in comprehension for memory retention of videos and passages. Okay, so this brings us to our meta-analysis. And essentially, what a meta-analysis is it's trying to get an average effect size across studies. And what we wanted to look at was these measurable clinical aspects of trigger warnings. So in aggregate, when we look at all these different studies, what's the final verdict on how trigger warnings affect, number one, the emotional responses to the material that they accompany, Number two, are trigger warnings themselves triggering or not, right? What are the anticipatory emotions associated with trigger warnings? The third question was, in aggregate, are trigger warnings causing people to avoid or to approach? And then lastly, are trigger warnings affecting content comprehension in a productive or an unproductive way? So for our meta-analysis, we pre-registered this study on the Open Science Framework. So we basically laid down what we're going to do ahead of time in the interest of transparency. And our inclusion criteria for these studies were really pretty simple. So number one, participants in a given experiment had to be shown a trigger warning that fit our definition of a trigger warning as talked about at the beginning. There also had to be a non-warning group included, right? There had to be some sort of a control group that we could compare, for instance, anxiety responding to across conditions. And then lastly, they had to measure one of these four outcomes as a part of their experiment. So this is just a short flow chart about how we identified studies. We used the keywords trigger warning, content warning, and content note. Type those into PsycInfo, Medline, PubMed, ProQuest, and Web of Science. This popped up a total of 236 studies. We then screened all the abstracts from those studies to see if overall, okay, is this an experiment? Are trigger warnings being administered, or is this like a theory paper or something? And so after screening the abstracts, we found that 22 of these studies fit our selection criteria. We then went in depth and inspected the manuscripts to see, okay, was there indeed random assignment to two different conditions? Was one of our four outcomes actually measured? Another thing that we did was we contacted all the researchers who had these manuscripts and said, okay, do you have any unpublished data? And it's important to do this because the well-known file drawer effect in the social sciences, right? So experiments that don't have significant results are less likely to be submitted for publication or published when they are submitted. So we wanted to make sure that we had the representative breadth of data on trigger warnings. We identified two researchers sent us back data. Unfortunately, those data sets did not comprise or didn't include our inclusion criteria for a study, so they weren't included, but we did at least check. So we ended up with a total of 12 studies that fit the description. Okay, so just a summary on what these included studies looked like. Total of 12 studies, a total of 144 effect sizes across all these studies, a total of 32 samples across the 12 studies, and 30 different types of measures. So it was interesting. There are a lot of different ways that people were measuring these different outcomes. For emotional response, you often had self-report questionnaires on a scale of 0 to 100. How anxious are you right now? Would be an example. Physiological response, such as electrodermal responding, heart rate. For avoidance, this was operationalized in multiple ways. One was opting out. So how often do people opt out of reading an article that there's a trigger warning placed in front of? Some compared rates of dropout from the experiment in the trigger warning versus non-trigger warning condition, or content choice as previously described. When there's a trigger warning affixed to some articles and not others, which articles do participants tend to go for? We also looked, and then finally for comprehension, pretty much all of these operationalized comprehension as memory retention. So it was typically multiple choice questionnaires determining how well someone remembered what happened in a video or in a passage. Okay, so for our analyses, like I said at the beginning, a meta-analysis is essentially an average effect size, but we have to account for dependencies in the data, which is to say, it may be that that one paper that we look at by this certain author is showing huge effects for trigger warnings, but all the other papers aren't. So we want to account for that potential bias in our data. So we do that by we did that in this case by conducting a 3-level meta-analysis with nested effects, accounting for these random effects of the source manuscript, the sample within the manuscript that was analyzed, and the type of measurement that was used. We also calculated Q statistics and made funnel plots to detect effect heterogeneity. the long story short on these metrics is that they're helping us to determine, do we think that we're measuring one large effect with random variation around that effect, or is it likely that there's multiple effects that are being aggregated into this average effect size? And I'll explain those funnel plots as we go along. Okay, so we're going to jump straight into the results here. For emotional response to content, so this is, are trigger warnings increasing or decreasing negative emotions in response to content that trigger warnings accompany? So just to sort of break down this forest plot here, each one of these boxes represents the mean effect size from each study. The size of the box indicates the average sample size in the study. These whiskers on the side of each box indicate the confidence interval. So what is the zone of uncertainty around the effect that was found? And you have typically larger confidence intervals for smaller samples. What else to talk about here? Okay, so and then the position of each box along this axis indicates which way that evidence is going. So boxes on this side are saying, okay, warnings increase distress to some extent. Boxes on the left are saying they decrease distress to some extent. Now on the bottom here, we have the aggregate effect size from the random effects model accounting for dependencies in the data structure. And the width of this diamond here indicates the standard deviation around that effect. So what we find here in aggregate is that this is pretty much supporting a null effect, right? The confidence interval is crossing 0. And so that's what we're finding for emotional response to content. When we look at the funnel plot here, the way to interpret the funnel plot, the notion is that as sample sizes get larger, and your standard error gets smaller, so as you get more precise, the effects are going to cluster tightly around this, this single effect that you're looking at, if there's a single effect. And then as sample sizes get smaller with less precision and larger standard errors, you're going to see a little bit more of a spread. So there should be sort of a funnel shape to your data. And what we're finding here is that broadly, there's some exceptions on each side, but overall, we're probably measuring one large null effect of trigger warnings on anxiety response to content. The Q statistic, if the Q statistic is non-significant, that is to say above, if the p-value is non-significant or above 0.05, we take that as evidence that there's not considerable heterogeneity going on here. Okay. All right, so let's look next at anticipatory emotions. Differently from emotional response to content, anticipatory emotions were giving us a reliable medium effect here. So it does appear that trigger warnings are reliably increasing distress themselves, right? The trigger warnings themselves are triggering. With that said, this has a pretty wide confidence interval around it, ranging from small to medium to large, but it does seem we're getting some pretty clear signal there. Now, when we look at the funnel plot, there's definitely some heterogeneity, though, in this effect, and that is accounted for by the random effect structure in our model. Of note, these three guys hanging out here, these studies were studies in which anticipatory affect was being measured with psychophysiological data. So it does seem there's this larger effect on psychophysiological indicators. So that's interesting. Okay, looking now at avoidance. Overall, as you can see from the aggregate random effect model here, there's not really a lot going on with avoidance. It doesn't seem that trigger warnings are causing people to either approach or avoid either way. And when we look at the funnel plot here, as we can see, there is considerable heterogeneity. Interestingly, these three effects, which are trending toward the opposite of avoidance, people actually heading toward trigger warning content, that was the study in which avoidance was being measured by which article do you choose to read, the trigger warning article or the one without a trigger warning. So it's interesting that when the study's designed that way, when people are given an alternative between reading something with a trigger warning versus not, in that experiment, people are going for the trigger warning. And that stands in contrast to when trigger warnings are used as an opt-out option. Okay, and then finally coming to comprehension, what we're seeing here is a net null effect. Again, confidence interval crossing 0. And for this one, for the funnel plot here, as we can see, not a lot of heterogeneity going on there. It appears that there's a pretty solid single null effect that all these data are clustering around. Okay. So to return to our original question about trigger warnings as operationalized in these 4 outcomes, our original question was, are trigger warnings helpful or harmful? And unfortunately, the underwhelming conclusion is that along most indices, trigger warnings are really not doing a whole lot of anything. They're not shaping whether or not people are approaching or avoiding content. They don't appear to be shaping anxiety response to the content, and they don't appear to be a detriment or a benefit to content comprehension. However, trigger warnings themselves are triggering, and reliably so. So if we're looking at sort of the balance between beneficence and harm, they are tipping in the direction of a net negative. Okay, so despite, I'm really glad we were able to do this meta-analysis, but I do think there's the trigger warning discussion is far from over. So I want to talk about some potential research that I think is going to have some exciting directions for trigger warnings, and then for other campus practices in general. All right, so one big question about trigger warnings, actually I'm going to take that off for a second, it's kind of distracting. One big question about trigger warnings, we've been able to look at this meta-analysis that looks at trigger warnings across populations, across samples, across people. One of the big questions, though, is how are specific subpopulations of interest responding to trigger warnings? For instance, individuals with considerable post-traumatic stress disorder symptoms. So when we look at, this is a graph from our experiment on trauma survivors, okay? And as we can see here, this looks very similar to our first experiment. Across trauma survivors who are reading distressing passages about violence, there's not a difference in anxiety response between trigger warning and control. However, there is this moderating effect of PTSD symptoms. And so just to sort of orient you to this graph, the line that's bounded by circles here is individuals with less severe PTSD symptoms, and the line that's bounded by triangles is those with more severe PTSD symptoms. So what we see for those with low PTSD symptoms is trigger warnings do appear to be making people less anxious, but that's not actually a significant difference between those who received a trigger warning versus control. However, for those with more severe PTSD symptoms, trigger warnings are making them more anxious, and to a significant extent. And so this is an effect that we'd want to see replicated. This is a one-off, but looking at how different characteristics of participants are moderating the effect of trigger warnings, I think will help us to make more informed choices depending on the class we're teaching and the students that we teach, or the patients that we're seeing. Another question is, how are trigger warnings functioning over time? So all of the experiments that we looked at in this meta-analysis, participants are coming into the lab, they're getting a couple of trigger warnings in a single session, and then they're giving their emotional or behavioral response. But if indeed trigger warnings are as widespread on campuses and in corporations as some people say they are, likely if trigger warnings are having an effect, it's an effect that aggregates over time in either the positive or the negative direction. And so one of my thesis students recently ran an experiment looking at what happens when you give participants trigger warnings at time 1, and then give them a little bit of time, about a week, and then show a trigger warning in the same context again after a week. And she was looking at multiple variables. This is self-efficacy, so perceived self-efficacy, perceived ability to deal with difficult content on the y-axis. What you see is your two conditions here, the control condition and the trigger warning condition. In this experiment, participants were viewing a video that was distressing, two different videos at two different time points separated by a week. The faded boxes are time 1 and the bold boxes are time 2. And what we see is that in the trigger warning condition, there's actually a large effect wherein participants' perceived self-efficacy is decreasing over that week. So that was an interesting finding and just another example of other ways we might look into the function of trigger warnings. Another interesting question to look at here, trigger warnings are just one instantiation of what Lukyanov and Haidt define as this trend of intellectual safetyism on campus. And we're defining intellectual safetyism as any sort of practice on campus or within a corporation that prizes emotional equanimity or quote unquote emotional safety over intellectual rigor. And so there's other campus practices that some are more and less empirically tractable. One is censorship, right? This idea of disinviting speakers or curating course content out of a concern for student well-being. I don't believe that censorship has really been looked into empirically as to whether that's conducive to student well-being or not. One of my current senior thesis students here at Harvard is looking at cultural messaging writ large. So looking not just at trigger warnings, but also at how often students are receiving messaging on campus that certain ideas or words are dangerous, and looking longitudinally at how that might affect their perceived self-efficacy and ability to complete a difficult task. There's other facets of safetyism that I think are also empirically tractable. One of these is, so looking at safe spaces and microaggression training, and this is some work I'm working on with a collaborator from the University of Michigan, Michaela Rodriguez. And just to give you some examples of how I hope we can look into contentious topics like these in a balanced way, here's sort of the way we're thinking about these. And yeah, the point being emphasizing both the potential pros and cons and including both as outcomes in experiments to give both sides a fair hearing, to hopefully do research in a truly heterodox way. So when we're looking at safe spaces, there's multiple ways to operationalize safe spaces. One way would be to say, encouraging students to affiliate with other members of their affinity group in an effort to increase the sense of safety and solidarity. So obviously on the pro side, this could engender a greater sense of support among students who are members of marginalized minorities, right? They're affiliating with others who understand their experiences and they feel supported and safe. On the other hand, we know from other psychological research that having diversity, so basically intrapsychic diversity, identity diversity within oneself is a predictor of greater psychological health. So this idea that, okay, I'm not just a first generation student, I'm also an actor, a sculptor, a member of the student choir. Identity diversity is conducive to greater resilience, perhaps because if you suffer insult to one aspect of your identity, you have this sort of diversified portfolio to serve as a source of resilience. So it's possible that practices such as safe spaces, while providing support, might also centralize one student's identity on a specific facet of their identity that's then very vulnerable if it's insulted. So this is an empirically tractable question and something we're hoping to look into. Another question is microaggression training. So we're defining a microaggression as an indirect, subtle, or unintentional discrimination against a member of a marginalized group. And so with microaggression training, an example might be, okay, I'm a first generation student, I do well on a test, and my professor makes a big show out of saying, wow, I'm just so amazed by how well you've done. Well, that social interaction may be ambiguous for me as a first generation student. On the one hand, I may interpret it charitably. I may say, wow, my professor is so supportive. On the other hand, I may think, well, my professor is surprised that I've done well. Are they assuming something about my background as a first generation student? And we know that particularly with social interactions tend to be characterized by ambiguity. And what microaggression training is doing, one of the things it's doing, this isn't all it's doing, is training students to find and detect sources of distress in these ambiguous scenarios in order to help folks to localize and identify those things and perhaps advocate for themselves in that situation. Now, we know from some psychological research that having certainty about the source of one's distress is generative of a sense of control and emotional equanimity in the face of ambiguous situations. On the other hand, microaggression training and other training like it may be conducive to cognitive rigidity, causing people to see situations or interpret them through a single lens consistently. And part of the, for example, therapy for social anxiety disorder, right? We want to enhance cognitive flexibility to allow people to consider, yes, the possibility that a statement was made for nefarious ends, but at the same time to consider alternatives. So the classic example with social anxiety, cognitive flexibility enhancement is to say, okay, you walk past someone you know on the street, you wave to them, and they don't wave back. Well, you can interpret that how do you typically interpret that? And typically someone with social anxiety is going to say, oh, they don't want to talk to me. They think I'm an unlovely person in some way. But it's also possible that they were having a bad day that day, or they weren't wearing their glasses, right? So again, looking at some of these cultural phenomena from both the pro and con side and making it empirically tractable. Okay, so I'm going to wrap up here with some implications. Returning to this question of to warn or not to warn, I do think that the balance, at least so far in this meta-analysis, is that overall trigger warnings are not doing really much of anything aside from making people more momentarily anxious. So that indicates they don't work. I think that it also indicates at the same time we don't have anything saying they're conducive to long-term harm, aside from making students more anxious briefly. So I don't think we have evidence to suggest that students are causing long-term psychological harm. However, in a lot of my conversations with other teachers and students and therapists, they've said, well, there's other reasons to warn aside from clinical concerns. One is showing that we care, right? Trigger warnings, we don't really care about the clinical implications of trigger warnings. We just want to show support and for members of marginalized communities. And I think that that's fine. But at the same time, at this point, I think that this meta-analysis and a lot of the research that's come out, it's fine to use trigger warnings in an effort to show that you care. But if you're claiming that you're doing it to care for people, clinically speaking, there's just not any good evidence for that. Another reason to warn that's come up in conversations has been avoidance of conflict in the classroom. So I've talked to a lot of teachers and lecturers who have said, well, if I'm honest with myself, the reason I'm affixing trigger warnings to certain content is I really just don't want the students in my class to get upset with me for presenting on controversial topics. And so that could actually be a good thing or a bad thing. Now, on the one hand, it may provide a way of, again, showing you care, and maybe students, after they've been shown you're aware that this content might be potentially triggering, are more willing to engage in discussion. On the other hand, this orientation toward avoidance of conflict may allow us to skirt over more important conversations about why we show triggering content in classes, right? In order to engage in debate about why is it important to expose ourselves to, in some cases, the horrors of history or the reality of the lived experience with mental disorders. I actually liked the trigger warning at the beginning of this presentation because it didn't just say, you may be potentially emotionally distressed. It also brought in the value of engaging with difficult content. And I think that more conversations like those about the pros and cons of viewing distressing content might be more productive than just a one-off trigger warning. A couple more considerations. One thing is just resource allocation in institutions. So I think that particularly when caring for students, clinically speaking, we want to move resource allocation toward making evidence-based practices available or evidence-based treatments available to those with anxiety and trauma-related disorders. If time and money are being shunted into figuring out what to put a trigger warning on versus not, if that's the institutional focus at the expense of seeking evidence-based treatment, then that is definitely an issue. And then finally, I think that the fine work that a lot of researchers have done on trigger warnings and practices like them encourage us to move toward empiricism, even with well-intentioned practices, testing whether or not they work, and adding that into the calculus, the ethical calculus on whether or not to institute such practices. And that is all I have. Thank you all very much.
Okay, great. Thank you so much, Ben. Everybody, please remember to post your questions to the Q&A. And looks like we do have a bunch of questions already coming up. So let me pass them on to you. Okay, the first one is probably more directed at me. Would it be possible to provide us with a bibliography of what has been discussed so we can follow up on this research later? The answer is yes. Ben provided us with a reading list, and we will be emailing that out within probably 2-3 days of the talk. So yes, you definitely will have that. Okay, so the first question is from either Stephen or Stefan. I'm not sure how this person prefers to be called. The question is, did you define anxiety or negative emotions, or were participants free to define those words themselves? Asking because I find that the word anxiety is used to describe unpleasantness as opposed to what might be diagnosable as clinical anxiety.
Yeah, that's a really good question, Stephen. Appreciate that. Yeah, we're marking this distinction between trait anxiety versus state anxiety. And at least in our experiments, what we did was we specified how anxious right now, describe how you feel right now. And we used these slider scales from 0 to 100. We asked about anxiety, but we asked about a whole host of other emotions as well. So we included positive emotions. We included emotions like sadness and disgust. Part of that was because we didn't want to, I'm sure that some participants could definitely have caught on. They were seeing trigger warnings. Oh, maybe this is a study about trigger warnings and anxiety, but we were trying to do our best to perhaps throw participants off the trail a little bit and to ask about emotional responding in a non-biased way. So anxiety was the target emotion, and specifically state anxiety.
Okay, great. Next question from Dahlia. Are there any findings about if trigger warnings may be more, less, or not at all effective for different populations, different subpopulations with different types of trauma, i.e. people with experience of sexual assault versus intimate partner violence versus EMTs versus veterans, etc.? If not, any hypotheses or thoughts you'd be open to sharing?
Yeah, thank you, Thalia. That's a great question. And there is actually, nobody's looked into characterizing responses to trigger warnings by type of trauma, which is an interesting question. However, a related question has been, okay, you're looking at how these trauma survivors writ large respond to trigger warnings, but really what we want to know is, are trigger warnings particularly helpful for people whose trauma is similar to the content that's presented, right? So for instance, if you're a combat veteran and you read a passage about a sexual assault, for instance, and you have combat trauma that didn't entail sexual assault, well, that trigger warning might not have been as helpful for you. Whereas if you're a victim of sexual assault, and a trigger warning might be particularly helpful if you're about to read a passage about sexual assault. There have been 2 experiments so far that have looked at that. In one experiment, they asked post hoc, was the passage that you read similar to your experience of trauma or not? Another passage or another experiment matched the type of trauma with the type of passage. And in both cases, it was not found that that trigger warnings were more effective for people whose trauma matched the content that they viewed. So that doesn't seem to be borne out so far. That's a great question.
Okay. The next question is from Joshua.
Mm-hmm.
What would the implications of all this be for someone like something like horror movies or stories, is there any sense of whether trigger warnings would have any beneficial detrimental impact on the enjoyment of such fiction?
Yeah, that's a good question. I guess it depends on what you mean by enjoyment. There's the research on morbid curiosity is very interesting. So looking at why do we do things like go on, why do we watch horror films? And one of the theories there is this notion of evolutionary preparedness, that humans may be, in some sense, attracted to uncertain negative stimuli because it's helping them to prepare for potential future catastrophes. I think there was an article recently out about how at the start of the COVID-19 pandemic, the number of people who are watching movies about plagues or epidemics on Netflix just shot up. And so I think that, again, you could, it doesn't appear that trigger warnings overall are dissuading people from approaching triggering content. So it appears they're not having much of an effect in either direction. As far as how they would, that's actually a pretty hot take. Like, would trigger warnings decrement the enjoyment that someone derives from viewing morbid content? I really don't know.
Okay, great, thank you. Next question is from Harriet. Harriet says, going meta, is there anything on the effect of publicizing the policy of using or required trigger warnings, which seems to suggest that lots of people will be triggered, that having some sort of anxiety response is normal and acceptable, and that everyone is vulnerable?
Okay, and it looks like, yeah, I'm asking because...
You can click the Q&A, Ben, yourself, and you can read it if you want to. There's a long question.
Oh, yeah. Okay, yeah, let me read the rest of this. I'm asking because increasingly I see students, frankly, mostly female, assuming that being anxious, depressed, etc. is normal and even commendable insofar as it shows sensitivity, and that therapy is for everyone, like going to the dentist. Yeah, I recently had to politely dissuade a good student from writing. Yeah, yeah, I think that it's an interesting question about cultural, this is one of these larger questions about culture on campus, which is what that thesis student of mine is looking into now. I think on the one hand, encouraging transparency. I do think there's a cultural movement now, indeed, toward encouraging transparency in the mental health struggles that people have, and destigmatizing seeking treatment. I think on the other hand, there's concerns about are we pathologizing quote unquote everyday distress or understandable distress that arises in the course of doing one's job or going to school. And I'm not sure what the net benefit is there, but it is a good question. Okay.
Great. Next question. Oh, this is from one of the staff members at the UBC PSCTC. They changed their name. So I forgot what they're actually called. Psychoeducational Services Center, Training Center or something. I apologize for not remembering the exact name. But the staff member says, since trigger warnings are intended to support people who may be more vulnerable to triggering content and may have a neutral effect on those without vulnerabilities, did your original studies ask participants about mental health history or use any measures of pre-existing depression, anxiety in your analyses? I'm wondering if there was any sort of individual difference effect.
Yeah, that's a great question. And like I said, not enough research has been done on that. As I showed in that example from the moderating effect of PTSD symptoms or PTSD severity, it does seem like measuring trait anxiety or pre-existing mental health conditions, there may be differing effects. Ironically, in that particular experiment, we found that trigger warnings were most unhelpful for the people suffering from more severe symptoms. But past that particular experiment, I don't think a lot of work's been done on that. I mean, you also have you have it being broken down in terms of, okay, this sample was crowdsourced adults, this sample with college students, this sample was trauma survivors. But I do think that a more nuanced examination of, Are they more helpful for folks with higher trait anxiety, higher PTSD symptoms, or more unhelpful for those groups? That's an important open question that, I mean, from our study, we saw they were unhelpful for that particular group, but we'd want to see that result replicated across studies.
Okay, great. Next question from Max. If you're able to say, what was the average approximate statistical significance of the results or relationships referred to as trivial in your summary of existing research? I might add to this maybe, even though it was non-significant, what was the effect size? How small was it?
Yeah, I think this is a really important thing in statistics, right? So many people focus on, was there an asterisk next to the effect? Was there a significant p-value? And so whether or not something's significant does not tell you anything about the size of the effect, right? So like in that college student sample that we had, there was a significant difference in anxiety between those who did and didn't get a trigger warning. But the actual average change in anxiety because of a trigger warning was trivial in size, right? So I think that at least when I'm referring to a trivial effect, it's significant. It's going against the null hypothesis, but the size of it is such that it's probably not a major concern.
Next question from Andrew. It occurs to me that a negative emotional response isn't necessarily bad. A student might find a reading or video unpleasant, but still think it was worthwhile for educational purposes, etc. I don't see that possibility reflected here. Is there any evidence about whether students themselves view these potentially triggering experiences as a net positive or a net negative?
Yeah, that's such a good point, Andrew. I do think that that's something I'm always tempted to talk about in my presentations, because it's really a pedagogical question or perhaps an aesthetic question, particularly when we look at I don't know, poems like The Wasteland or Guernica, the painting Guernica. Part of the point of some works of art is to engender an emotional response, to resonate with the lived experience of the artist. And so that is another concern I have about trigger warnings, is that if they're causing people to view that distress as inherently pathological versus a part and parcel of experiencing art, then that could potentially be an issue. And you also mentioned, where is it? Yeah, a student might find reading or video unpleasant, but worthwhile for educational purposes. We did do, I noticed actually in the quote unquote trigger warning prior to this webinar, there was a statement about, although this is difficult, that sensation of difficulty, that emotional unpleasantness could also be viewed as a sign of growth. One of my thesis advisees recently did an experiment where she was trying to determine, is there such a thing as a pro-resiliency warning, right? So in her experiment, she had a control condition, a trigger warning condition, and then like a pro-resilience warning condition was like, okay, while this experience is difficult, we think you'll find it beneficial to your understanding of the human condition, et cetera, et cetera. And that didn't seem to have any effect. Like even if it's a positive warning, it doesn't have a net effect on anxiety or comprehension. But I think the question that you're raising is really, it's more of this aesthetic question of, is some art meant to disturb, which is a great question, but not a question I can make a call on as a clinical psychologist.
Okay. Next question. Oh, sorry. The question says it was already answered, so I'll just skip that one.
Oh, yeah.
Okay. Let me just dismiss that question. Okay. Next question from Max. Are you able to preview any results from the ongoing longitudinal study you referenced? The potential long-term impacts of trigger warning seems central to this conversation.
Yeah, it's a great point. And like, I don't think I quite mentioned this in my presentation, but we've been trying to find ways as a lab to really honestly engage with a lot of these campus practices, because trigger warnings are just this small part of a larger movement. And how do you operationalize exposure to that movement? the short story on the repeated administrations of trigger warnings in the longitudinal study. What we found is that over multiple time points, trigger warnings are not amplifying anxiety responses. They're not changing comprehension. What they are doing in the long term is decrementing positive aspects of psychology. So I believe it was self-efficacy and stress appraisal. So people over time, after seeing multiple or these 2 sessions of trigger warnings, they are appraising themselves as less resilient. And there's this important distinction between increasing negative outcomes versus decreasing positive outcomes. And so, yeah, I think that more research needs to be done on that. But in the long term, it appears there are much larger effects in terms of decrementing positive outcomes versus decreasing negative outcomes.
Okay, great. Next question from Seiler. What are the current research findings on the helpfulness of trigger warnings to warn individuals and allow them to make an informed choice to engage in an experience? E.g., not watching a specific movie or attending a specific event. Is any follow-up done with the individuals who discontinue in these studies to capture their experiences? How does voluntary participation in trigger warning research affect the generalization of these results to the greater population? Those that did not want to participate in the trigger warning research.
Yeah, that's a great question, Tyler. I mean, you're speaking about, well, I'll take both questions in order. So one is, yeah, did you ask their reasons for discontinuing or avoiding? Qualitative data is really something that there needs to be more of in this field. The only qualitative data that I've seen came from Bridgeland et al. Down in Australia, and they didn't look at avoidance, at people's reasons for avoiding. They did, however, look at what people thought about viewing the content that had a trigger warning before it. And what a lot of people were saying was, I was actually really relieved that the content wasn't as distressing as I thought it was going to be. So with avoidance, I do wonder if, for a lot of folks, trigger warnings are sort of inflating their sense of how dangerous or distressing it's going to be. The other issue you're talking about here is this selection bias, right? So maybe we're not seeing an effect on avoidance because folks who would avoid if they saw a trigger warning are less likely to participate in an experiment on trigger warnings in the first place, which is a really good point. I know that our studies, we used a incomplete disclosure design. We got approval to basically say, look, this study is about viewing, talking about your responses to media. We didn't make any mention of trigger warnings in the initial study advertisement materials. For the other studies, that may have been different. I don't have all those studies in front of me right now, but whether or not people knew it was about trigger warnings, that would definitely be an important consideration.
Okay. Next question here. Let me put that there. Okay, next question from Alex. I think some would argue that the benefit of showing we care is about more than whether or not one particular statement about one particular reading does or doesn't move the needle in some measure of response to one thing. It's about being the sort of instructor who is consistently warm and fuzzy. Is there evidence that the sort of instructors who prefer to give trigger warnings are in some way more effective, especially for marginalized students?
Yeah, okay, so it sounds like, I don't want to mischaracterize the question here, but it sounds like this is more getting at, are trigger warnings more about maintaining a classroom environment or an image of the instructor as a certain kind of person, as someone who cares, and rather than whether or not it's moving the needle on any sort of outcome. And there is one study that sort of speaks to this, because this is really more getting at motives, research on motives for giving trigger warnings. And there was a study by Bruce et al. That looked at this is sort of tangential to the point, but I think kind of gets what you're talking about. Why do students request trigger warnings? And they gave all these different reasons and had some qualitative data as well. And basically, students who wanted trigger warnings were not students who had mental disorders. They were not students who were particularly concerned about some marginalized aspect of their identity. They were students who felt betrayed by their institutions. And so that's an interesting piece of data, because it seems that maybe a lot of this has never really been about clinical outcomes in the first place. It may be that trigger warnings are more this symbolic show of support. So students want to know that their concerns are being taken seriously. And so trigger warnings may be more, the way they're functioning on campus is more in a symbolic way. And I don't know if instructors who prefer to give trigger warnings are more effective for marginal, and whether they're more effective for students who are members of marginalized minorities. That's a good question, but there is something to that question, this idea of trigger warnings as sort of a symbolic device rather than a clinical tool.
Okay, next question from Dan. How might our understanding of trigger warnings change in a cultural environment in which such warnings are common and expected? What experimental assumptions might need revision?
That's such a good question. I mean, I think that part of the issue with researching diffuse cultural phenomena like trigger warnings or safe spaces is that I think it was around 2014, a lot of the brouhaha about trigger warnings sprung up, and they weren't yet kind of a household name. But at this point, I think it was Brandeis University. I think it was Brandeis. They put out a statement of terms that were considered insensitive and that were no longer to be used. And one of the terms on that list was trigger warnings. And so the impression that I have is that I guess that the term trigger warning has been so thoroughly memed at this point that even using the term trigger warning in an experiment might call up all sorts of associations other than the content I'm about to view as dangerous. So that's one of the tough things I think with doing research on phenomena like this is the goalposts keep moving. The cultural connotation of something like a trigger warning is changing very rapidly. I'll say too that even while I've been doing this research, I don't know what it's like up in Canada, but I do think that the cultural attitude toward trigger warnings has changed a good deal, even in the last 5 years. Yeah, but experimental assumptions. Yeah, I think, again, someone mentioned qualitative data. I think that it's probably a good idea to do some assessment at some point on how people are appraising trigger warnings themselves. Less research has been done on that. Most of it's been like anxiety response to trigger warnings.
Okay. Next question. We have 8 minutes left. Next question from Joshua. I don't come from the discipline of psychology. Is this subject being investigated enough? There doesn't seem to be a lot of research yet, but I do not have the right background to assess what is a lot or enough.
Yeah, that's a really good question. After doing the literature review on trigger warnings, you saw the number of articles that turned up, which was like 200 something, and then the number of empirical articles, which was 12. Or empirical articles that met our criteria, which was 12. So there are a lot of opinion pieces on trigger warnings. There's a lot of moral ethical debate on trigger warnings, far scarcer empirical research. As far as psychology goes, I mean, we want to have that first funnel plot where we're seeing, okay, a whole bunch of effects that are clustering around what we think is one main effect. So with something like response anxiety to content, I think that's nailed down pretty tight at this point. Trigger warnings aren't doing anything. But when we see more heterogeneity and sparser studies, like with something like with avoidance, I think we could probably use some more studies on that, because we don't yet, if there are multiple effects that these studies are picking up on, we then have to look into what's causing these multiple effects and see if we can replicate down those multiple pathways. So I don't think enough research has been done. The problem is with a lot of the replication research, it's just a lot more boring than being able to publish the first paper on trigger warnings. So I think we could definitely use more research at on certain aspects of the trigger warning debate. It's just finding folks who are willing to do that research is in my experience, it's been hard to find such people.
Okay, next question. To what extent is such a warning a signal that is unrelated to its purported function, namely a self-referencing signal that you are a woke academic?
Okay, so
from Greg.
Yeah. Well, this kind of gets into that previous, this previous thing about signaling values, signaling that you're a part of a certain group or ideological disposition versus an actual clinical tool. And given, I do think a couple of papers have looked into why people choose to give trigger warnings. The problem is that the way that a lot of those questions are worded doesn't explicitly address this question. It usually includes things like, well, I believe that students of marginalized identities need to be given additional tools to succeed in the classroom. So that question hasn't, I can't give an empirical statement on that, but from personal conversations with colleagues, I've heard either if someone aligns themselves more on the leftist side of things, maybe they do honestly believe they're helpful. I know a lot of folks who are sort of closet heterodox who have said, I use trigger warnings because I don't want to get fired. And so I do think there is some of that. The extent to which it's prevalent, the extent to which there's like a silent majority that actually disagrees with trigger warnings, but is still affixing them to things. I don't know. I don't know what the prevalence is there.
All right, next question from Ellie. Has anyone looked into anxious negative responses to trigger warnings as they relate to people simply not liking trigger warnings versus feeling anxious in anticipation of worrying content?
Super good question. Yeah, so you might have a negative response to a trigger warning because, it's causing anticipatory anxiety. You might have a negative response to a trigger warning because you're offended by the use of trigger warnings. You feel you're being condescended to, or this is a waste of your time. That's the thing about self-report with anxiety or psychophysiological responding, right? It's anxiety, but what brought about the anxiety? There's a really interesting study that looked at the moderating effect of trigger warning opinions. And what they found was that folks who were in favor, who saw trigger warnings as protective versus a device of coddling. So folks who were invested in trigger warnings and thought they were worthwhile, those folks were actually being made more anxious by trigger warnings, which sort of intuitively makes sense because if you lend a lot of credence to trigger warnings, you're probably more likely to buy into the emotional response they're forecasting. But that's a really good point, right? Anxiety can arise for any number, or negative affect can arise for any number of reasons.
Okay, I think we have time for one more question, and we know we have more than one question, but let's jump to the last question before we switch over. And this is again from Joshua. If the pro-resiliency warning has no clinical net effect, might it still be the best way given the other reasons to give trigger warnings? Support and avoiding conflict.
Yeah. I give pro-resiliency warnings in classes that I teach. We usually have a long, it gets back to this idea of like, is it not more productive to have an in-depth discussion about the importance of viewing distressing content and having that enter into the discussion rather than giving these one-off trigger warnings in an attempt to avoid, in an attempt to stave off such perhaps an uncomfortable conversation. If ultimately all that trigger warnings are doing is making people a little bit more anxious in the short term, it probably does come down to what are the other values at play. For me personally, I place a very high premium on being able to have open discussions with students. So I do use pro-resiliency warnings, but I don't use them with the understanding that they're going to be clinically beneficial. So I think it's a great question. Ultimately, it comes down to values other than clinical efficacy.
Okay, great. I'm going to stop the questions there. I apologize for anybody who has a question that we did not get to, but I reposted a link into the chat. And so if you click that link and you're interested in continuing the discussion in more interactive format, please do click that link now. Some people couldn't copy it over. I'm able to copy it from my end, so I'm not sure what the issue is, but it does show up as a hyperlink as well in the chat. So if you click that, it'll take you over. You may have to wait a couple minutes. I will say that I forgot to give Ben's bio here at the beginning. I'm so eager to hear you speak. So let me kind of give that at the end here. Ben is a doctoral student, PhD in clinical psychology from Harvard University in Cambridge, Massachusetts. He received his BSc in kinesiology from the United States Military Academy in West Point, New York, and then as MS in general psychology from the University of Memphis before entering his PhD program at Harvard University. And I added my own little anecdote here. He is clearly an up-and-coming scholar with approximately 25 peer-reviewed publications. One of his recent co-authored articles is titled Helping or Harming: The Effects of Trigger Warnings on Individuals with Trauma Histories, published in the high-profile journal Clinical Psychological Science. So with that said, Ben, thank you so much for taking the time. I guess we're late afternoon over there on the East Coast, but thank you so much for participating in the Confronting Hegemonic Ideas speaker series. I also want to thank the audience for being here. We do have one last talk in the speaker series, and that will be next month in July. In addition, if you're interested in sharing this information, all the talks are posted online as well. If you can email me for more information if you like. But I do think it's important to have these conversations and to ponder. When Ben was talking, some of the questions are coming up. One of the things that came to my mind was the whole issue and debate over critical incident stress debriefing. And for those of you who are outside of clinical psychology or psychology, this is basically, and I'm going to be tongue-in-cheek here, and I apologize if it's offensive, but it's sort of like if something terrible happens, like a bank robbery or a shooting at a school, all these counselors and psychologists get parachuted in from out of nowhere, and they descend upon the university and give therapy to everybody who's around. And a lot of the push has sort of been, it's unethical not to do this. But if you look at the research, it's actually not helpful and slightly harmful for the vast majority of people. And to use it as a general response or preventative response causes more harm. But you have people who are so firmly in belief that we need to do this for ethical reasons or for moral reasons or for, just I'm a good person, I need to do this, I need to do something. But then they're neglecting that the evidence is pretty strong that it actually does cause a slightly negative effect in most people. So whereas you may want to, connect with the people and say, I'm offering this to you, you have to sort of, connect that with, well, I'm actually perhaps causing harm to more people than I'm benefiting. And so this analogy really drew up a lot in my mind there. So I appreciate you sort of bringing up such a controversial topic. I'm sure there's people on both sides in this audience as well as out there. And I look forward to reading some more of your work in the future.
Thanks, Rob.
Okay, with that said, if you haven't clicked that link, please click it now or email me. I'm going to close the chat in about 15 seconds and we'll open up a Zoom room for those who are interested in talking some more. Okay, thanks again, Ben.